Thank you for those that are here in person and in our web conference. Basically what we'll do is we'll have a couple folks give a few comments, and then we'll open it up for questions. And for the folks on the WebEx, we'll ask that you ask your questions through the comments section, and then I'll read them out loud for the group so that we don't have confusion over who's asking questions. So with that, I will introduce our CEO and President, Paul von Ebers.
Thank you, Andrea, and thank you, everyone from the press who's here today. We're here with a very simple purpose: to announce a series of forums that we're holding for employer groups across the state to talk about the issue of the health reform law. As you know, the Affordable Care Act, as it's called, was passed into law back in 2010, and we've been working on coming up to date with that law since 2010. But there are some very important provisions of the law that are coming into effect that will have an impact on employers as well as individuals January 1st. And some of those changes people will start having to make choices about this fall. And so we think it's very important for us to be providing assistance to employer customers of ours so that they understand their choices and their obligations and the implications of various factors of the health reform law. So we will be holding these forums around the state starting next week and continuing through the rest of the month. And we have had very good response in sign-ups, early sign-ups for these. Essentially, what we're trying to get across with these forums is that the health reform law is a major law. It's probably the biggest change in health care since the Medicare Act was initiated in 1966. It's complicated. There are a lot of things for employers to understand. We at Blue Cross Blue Shield of North Dakota have been working to understand the law since it was passed in 2010. We've learned a lot about it. We want to share that information with our customers. We think we can help employers across the state respond to the law in the way that's best for their individual business. And the implications really are different depending on the size of business, the type of business, the type of employees that a particular business has. So we think it's very important to get together and share this information and answer questions. So our purpose is to provide real answers to real questions that employers will have with regard to this health reform law. We have spent a lot of time getting ready for this. We think we have some very valuable resources to offer. And to tell you a little bit more about that, I'm going to invite Mike Potts, who's our Director of Employer Group Services. He'll be one of the lead presenters in these presentations, and we'd like to give you the opportunity to understand what we'll be doing in those sessions, and then also ask Mike and myself and others here any questions you might have about the law or how the sessions are going to run. So, Mike, I'll turn it over to you.
Thank you, Paul, and good morning, everyone. As Paul mentioned, starting next Monday, a team from Blue Cross Blue Shield of North Dakota will be traveling across the state to meet with employer groups to help them feel informed and confident about the upcoming healthcare reform law changes. We've had a long-standing, strong commitment to our relationships with our customers, as well as strong communication patterns. And so we think now is the appropriate time to have this conversation as we look forward to the changes coming this fall. There will be 8 sessions in each of the 8 major cities. We're starting in Minot next Monday, and we'll be ending in Fargo on the 27th of the month, which is a Thursday. There will be sessions for small groups. There will also be sessions for large groups. And the reason why we've broken those out is to give them the opportunity to answer or ask questions that are specific to their business. Some of the topics we'll be covering during these sessions will be the federal exchanges and how they work. Those will be implemented this fall. We also want to give employers an understanding of the insurance mandate that they are under and how they may be subject to penalties if they don't meet all the requirements of the mandate. We also want to provide an overview of some of the tax implications. We won't be offering tax advice, but we want to point them in the direction so they can begin to work with their own accountants to do the research themselves. And then we also want to make them aware of the changes to insurance plans and benefit packages that will be coming. They will be different based on the type of group and the type of coverage that they have. So we want to help them walk through an assessment of their own readiness for 2014 so that they can be as prepared as they possibly can for the upcoming changes. I would also like to introduce Luther Stueland, who is our Director of Health Policy, Impact, and Exchanges. He will be part of this team that will be traveling as well, and so he can answer some of the specific questions related to healthcare reform provisions. So at this point, we'd like to open it up for questions related to the law, either myself, Paul, or Luther.
We certainly would welcome questions about the forums or the law itself, anything along the lines of the health reform topic that you might be interested in.
How prepared do you think employers are? Are they looking at this at all, or do you find when you talk to them that they're maybe overly prepared?
I think there's still a lot of confusion among employers in the state about the law. This is actually not our first round of forums. We have done some prior meetings with employers, and I guess our general feeling is they're anxious to learn, but they don't know all the detail. Would that be a fair assessment, Mike or Luther?
Yeah, just to add to that, part of the goal of this process in going through these forums is to really provide employers with a framework so that they can do their own assessments as to whether they're going to be ready for this fall. And so we're going to provide some general education about the regulation and then offer a framework for them to assess their own specific situation based on the type of group as well as their coverage.
It was popular during the political season for politicians to be in small businesses, and this was the hot topic. Small business owners saying that this will possibly eliminate their business. Are you seeing on your side that costs will go up significantly for a lot of small businesses?
We are. It does vary quite a bit by the type of employer situation. So it's really hard to say one size fits all. So that's a caution, which is one of the reasons why we're trying to tailor these to the individual needs of employers. And we also do provide individual employer consulting advice. Outside these forums, if an employer wants us to walk them through their choices and their options, there are some additional requirements of the law that are going to add to costs. For example, there is a tax on health insurance that we will have to pass through to our customers, and so that will be an increase in costs. There are also some different rules on how we can set rates for individual groups. For example, a group that has a lot more younger people versus older people would tend to actually see more of a price increase because of the new rules. We're not allowed to take into consideration essentially how low cost young people are, nor are we allowed to take into consideration the costs that come with older workers. So if you have a business that has mostly younger workers, you might see a bigger increase. If you have a business that has mostly older workers, you might see a decrease. So it varies so much by individual group. That's why we need to be talking to groups almost individually.
I have a question from Hannah Johnson with the Business Tribune. Can you detail when each session is being held?
Yes, the question has to do with when are the sessions being held, and they are being held starting next Monday in Minot, and then we will move to Williston on Tuesday, Dickinson on Thursday, and then Wednesday, and next Thursday will be in Bismarck. And I don't have the media packet in front of me. The final dates for the following week are in the media packet, and we're starting in Devil's Lake on Monday, and we do Grand Forks Tuesday, I believe it is, and Wednesday Jamestown, and then back in Fargo on Thursday.
I have another question from Hannah. Also, what other healthcare organizations are joining the federal exchange?
That's an excellent question. The question is how many other health plans will be on the federal exchange. We really don't know the answer to that yet. The North Dakota Department of Insurance has not announced their information on that. And in addition to that, we have not heard an announcement from the federal government. So, you know, we have some guesses of our own, but we don't have solid information. I would say we would expect to see other health plans on the exchange, just, you know, without getting into names or what our guesses are. We fully expect that there will be Blue Cross Blue Shield of North Dakota and at least several other choices.
From Hannah and Bismarck, how can employers sign up if they want to? Can they just show up?
Very good question. The question was, how do employers sign up? Each of our employer groups have been sent a invitation to the workshops and the forums, and so they can go on to healthreformworkshopsnd.com, or they can return the postcard directly to Blue Cross Blue Shield.
Okay. Well, great. Thanks for being here. Not a real hard topic today, so. However, it's a very complex topic, and I would just make a general offer to the media. It is a very dense, complicated topic. If you want information about any specific thing about it, we'd be happy to answer your questions at any time. You know, it's a 2,000-page bill. There are probably 7,000 or 8,000 pages of regulations that have come out since then. It's hard to keep on track, but if you've got, you know, somebody asks you a question and you don't know the answer to it, please just give us a call. We'd be happy to talk to you about it. We think the more people understand the law, the better off everybody's going to be. Just as one example, we think that we have about 15,000 people who buy health insurance directly from us who are going to be eligible for a subsidy on the exchange, just for example. We're going to do our best to communicate to them, but we think there's a lot of confusion, and the more people know the facts, the more they'll be able to make choices about how to respond to the law. So please ask, you know, anytime, not just today. If you've got a question about it, just give us a call and we'll get you the information. Thank you.
We do have one more question now.
Okay.
From Hannah, will these sessions be open to the public, and what about media?
That's a great question. They're open to the public in the sense that they're open to any employer or customer of ours. We're simply trying to work directly with our customers. These forums are just for employers. We're focusing on the implications for employers. We're certainly happy to respond to questions from the public, and there will be other opportunities to talk directly with individual consumers, but this one is for employers. As far as the media is concerned, there are, you know, media organizations that are our customers, and we have invited all of our employer customers. We're not allowing, you know, cameras or microphones in the room, not because there's anything secret about it. It's really to allow our employers to feel comfortable to ask any question they want, get an answer without worrying about whether they're going to be on TV. Now, on the other hand, if anybody who's there wants to talk to the media after the meeting, before or after the meeting, you'd be welcome to interview people if they choose to be interviewed. And certainly we'll be available at those meetings to answer questions as well.